Welcome to the Dental Capsule. In this series, we'll cover different dental topics and real clinical situations in short, easy-to-follow capsules, designed to help us improve how we manage our daily cases.
In this capsule, we're going to talk about how to safely manage cardiac patients in the dental clinic. These are some of the most common medically compromised patients we see, and with the right approach, most of them can receive routine dental care without problems. First, start with a good history. Always ask about the exact cardiac diagnosis. The current symptoms like chest pain, shortness of breath, or palpitations. All the medications they take, especially beta blockers, nitrates, diuretics, and anticoagulants, and any recent hospitalizations or emergency visits. And if the patient is on anticoagulants, remember we already have a full video covering how to manage them. To number 1, hypertension. Hypertension is extremely common, and most patients don't even feel symptoms. Before starting any procedure, especially surgical work, you should measure the blood pressure. If it's below 160/100, routine dental treatment is usually fine. If it's above 160/100, delay elective treatment and monitor again. If it's above 180/110, the patient should be referred for emergency medical care, not dental treatment. Use a stress reduction protocol, keep visits short, and avoid giving large amounts of vasoconstrictors. And be careful with drug interactions. For example, NSAIDs can reduce the effectiveness of antihypertensive medications. Number 2, ischemic heart disease, angina and previous myocardial infarction. Stable angina is usually old, predictable, triggered by exertion, and relieved by rest. Most routine procedures are safe, but keep these precautions. Schedule morning appointments, keep the visit short, keep nitroglycerin accessible, limit the dose of epinephrine, and avoid sudden stress or pain. Unstable angina is recent, worsening, occurs without a clear trigger, and may require medication to be relieved. This is a red flag. No elective dental treatment. The patient should be referred for medical evaluation. For patients with a previous myocardial infarction, if they had an MI within the last 6 months, elective dental care should be postponed. After 6 months, you can treat them the same way you treat a stable angina patient, with stress reduction and limited epinephrine. Number 3, heart failure. Ask if the patient can lie flat, if they wake up at night breathless, or if they get ankle swelling. Compensated heart failure usually allows dental treatment, but keep the chair slightly elevated. Decompensated heart failure, where the patient has shortness of breath at rest or cannot lie back, requires no elective treatment. Refer first. Avoid NSAIDs in heart failure patients because they cause fluid retention and can worsen their condition. Number 4, infective endocarditis risk. Recent guidelines show that not all cardiac patients need antibiotic prophylaxis. Only a very specific high-risk group. These include prosthetic heart valves, a history of infective endocarditis, cyanotic congenital heart disease, congenital repairs with residual defects, and cardiac transplant patients who developed valvular issues. Give 2 grams of amoxicillin 30 to 60 minutes before invasive procedures. If the patient is allergic, prescribe 600 milligrams of clindamycin. Scaling, extractions, and periodontal surgery are the procedures most likely to require coverage. Number 5, arrhythmias. For patients with atrial fibrillation or other rhythm disorders, minimize stress, avoid excessive epinephrine, and avoid medications that interfere with antiarrhythmics. If the patient has a pacemaker or an implanted defibrillator, avoid electrosurgery units and some ultrasonic devices, depending on manufacturer guidance. Now, regarding epinephrine use. In most cardiac patients, epinephrine is allowed, but only in minimal doses. Try not to exceed 0.036 milligrams per visit, which equals about 2 cartridges of 100,000 concentration. Always aspirate, inject slowly, and avoid epinephrine in retraction cords. And about the stress reduction protocol we mentioned earlier. This is one of the most important parts of treating cardiac patients. Use good communication, create a calm environment, schedule morning appointments, provide excellent anesthesia, avoid long waiting times, and consider nitrous oxide if it's available. Reducing stress significantly decreases the risk of hypertensive spikes, angina episodes, and arrhythmias. Final message: cardiac patients can be treated safely in the dental clinic. Understand their condition, respect the limits, minimize stress, and adjust your treatment plan when needed. And when in doubt, a quick call to the cardiologist can prevent serious complications.
Thanks for watching. If you found this helpful, don't forget to like and subscribe. Share your thoughts or questions in the comments. We'd love to discuss them with you. See you in the next capsule.